I'm Hailey,
And I'm Jordyn.
and today we're going to be going over the care and considerations when treating a patient with Down syndrome. What is Down syndrome?
This condition is also known as trisomy 21. The CDC defines Down syndrome as a condition where an individual has an extra copy of chromosome 21. They say chromosomes are small bags of genes in our body's cells, which help our body to determine how to correctly function and form. So, when an extra chromosome is added, certain aspects of development and body functions are different. Here's some tips to understand the condition.
First, we'll go over physical characteristics. Some things you might see can include a flat facial profile, poor muscle tone, a short neck, slanted eyes in an almond shape, small hands, or even a small mouth. Here are some more things you can use to understand the condition.
They have cognitive behaviors like impulsive behavior, delayed developmental milestones, poor memory, poor ability to comprehend verbal information, and a short attention span. The first step in treating these patients.
When treating a patient with Down syndrome, the most important first step is to conduct a thorough medical history. Unlike other patients, these patients have a higher chance of comorbidity. Conditions include cardiac problems, ear infections, hematologic problems, immune system abnormalities, obstructive sleep apnea, vision issues, and others. So, how will we manage these considerations when performing dental hygiene treatment?
Patient medical history should always be reviewed with the caregiver, as the patient may not be able to fully understand what's being asked. Effectively communicate using simple, clear language. Visual aids may be helpful in patient education. If the patient has visual impairment, utilize the patient's mouth for education. Individuals with Down syndrome may have memory issues, so repetition may be needed. Minimize noises and other stimuli to avoid distractions to the patient, and understand the condition before performing care is always a must. Management considerations for performing dental hygiene treatment. Here's some things you'll see.
Some oral findings in these patients can include a class 3 malocclusion, congenitally missing teeth, dry or cracked lips, fissured tongue, poor oral hygiene, macroglossia, which is a large tongue, high incidence of periodontitis, and a low prevalence of decay due to that delayed eruption. And sometimes they can also have xerostomia, which can be due to their medications. Here's some oral health education options.
Education from the dental hygienist directly impacts the oral care of the patient. Patients should be informed to brush teeth at least twice a day, use a fluoridated toothpaste, and floss at least once a day. Floss aids may be beneficial for the patient or caregiver. They should also visit the dentist regularly and limit sugary foods and drinks. Patients with Down syndrome are seen every 6 months like any other individual unless specified otherwise based on their oral health.
Thank you.